A very important corrective exercise for postural positioning and general balance of our hips is external rotation. We're going to do it by the name of the clamshell today, which you've probably seen lying on your side or doing in various positions. We're going to utilize a band to get started. The clamshell is an external rotator exercise for the hip, as I mentioned. Those are your gluteus medius and gluteus minimus muscles. So those are upper butt muscles that come around more the side to the lower back a little bit. And this can really have impact on your lower back stability or lower spine stability and overall quality of life or joint health throughout not just the hip bone, but your entire posterior chain here. So I'm going to do it from a seated position. The main reason I like to use this for a corrective exercise is dominance through the big toe and knee knocking in squatting patterns. One of the more common problems that folks have with their squat is they go to stand up and they want to use that ball of the foot and big toe. That's what they're more confident in. They knock those knees and they stand up here. It's also just something ladylike to squat here, but boy, do the knees really not like that. You're wearing out the inside of the knee here. So we're going to build up those lateral hip muscles in order to help keep the glutes as a dominant muscle group in that squatting pattern, to avoid the knee knock and to keep good hip knee ankle alignment and stabilization. We use that mini band as our mode of resistance, and we load it up right above the knees. Technically, you could do an isometric exercise that just pushes your hands into your knees and your knees out into your hands and hold that, and you'll feel it here. Let's cover the technique of this clamshell from a seated position. From the forward position, we're going to start in our postural set of our lower body, heels under the hips, knees in front of the hips as well, and we're going to keep that there as position A. When we push our knees apart against that band, that's the shortening contraction of these external rotators, we're going to also roll our feet out onto the outer edge and push those feet tight into the floor. You'll feel an extra squeeze from your butt as you do that. And as you bring it back to the midline, we're going to stop right at the hips, hip width apart, and you're going to control that wiggle wobble. So we squeeze out to the side, we control the wiggle wobble coming back in. And there'll be a wiggle wobble as long as you get enough resistance in there. From the side position, you can see that my knees are directly over my heels. I'm sitting up nice and tall with my spine in line and my shoulder blades down and back in that seated posture. We just want to make sure we're not compensating, leaning side to side away from an achy hip or to a dominant hip or anything like that. So we're sitting up nice and tall and we're doing the same movement, and it looks very minimalistic from the lateral view. Really, it's the postural and the setup and the positioning that's important. One last thing to consider when you're doing this is the deep pelvic floor and deep abdominal squeeze. I want you to really sit up tall and engage tight through that core. And then you have to breathe. And if you can talk and demo at the same time, that's pretty good. So you're pulling in that belly, controlling that clamshell in external as well as internal rotation.